internal medicine specialist, Dr. Zaheer Shah. Dr. Shah, great to have you back with us. How concerning is it to you that the case that was found in Colorado is actually somebody that doesn't have a history of travel?
It's not particularly concerning to me. I think once the investigation is completed, I think we're going to learn that someone from London did in fact bring this into Colorado. And eventually, this poor individual in rural Colorado ended up getting the genetic mapping of it is entirely consistent with the same variant, what's known as the B117 variant that is found in London. We know that this variant is already in most European countries, and it probably arrived here in the United States sometime in November or December. And there is another independent variant that is also more infectious that's been found in South Africa, but genetic mapping of that has made it clear that it is not B117 variety, but that it's a different variant. But the one that we've now discovered in Colorado, because of our testing, is simply a manifestation of something that probably has already happened in November or December, which is that that variant came from London and has been disseminated in Colorado, and I suspect in other states in the United States already.
So is there a way, Dr. Shah, for us to differentiate between this very new contagious strain and the virus that we already know?
Clinically, I don't think so. I think that, there are certainly state labs like the one in Colorado that went specifically looking for this variant. But I can tell you from being in a clinic that I run where we are testing for both the PCR testing that we can do for the swab of the nasal passages. And in that, it simply is not at this current time set up in most labs to be able to distinguish the B117 variant from the normal version of SARS-CoV-2, which is responsible for COVID-19.
Right now, we have President-elect Joe Biden saying that things are going to get much worse before they get better. We're already seeing cases across the United States just skyrocket. How concerning is it that this new strain is even more contagious? How much more difficult will it be for America to manage its outbreak when you look at this new strain and the effect that it's having in the UK, the impact that it's having?
Kilmany, this is not good news. We have had a terrible track record in this country of attempting to contain COVID-19 using what are known, proven defenses like face masks and social distancing. We just, as a nation, for a lot of reasons that are really too complicated for even one conversation with you, they're too complicated politically to get into. But the reality is that we already stink at this. And now suddenly there is a new version of the virus that causes COVID-19 that is estimated by the CDC to be 70% more transmissible. In other words, 70% more infectious. Let me help your viewership understand what that exactly means. So, there have been changes, small genetic mutations that have occurred in the spike protein. We talk a lot about the spike protein. That's actually also what each of the new vaccines is targeting. The Pfizer vaccine and the Moderna vaccine both are an mRNA-delivered version of the spike protein, which is the main trigger for our human immune system to respond to this virus. And now there are small genetic mutations in that, which this B117 variant of it, which makes it much more likely to successfully implant in nasal epithelium of an infected person, multiply there very rapidly. So that means that the viral load, you might have heard that term, is actually being carried in raw numbers by a person who's been infected with it, that is going to go up probably by about 70%. And what does that mean? It means two things. One, that means that the likelihood of that person actually getting clinical disease by aspirating those secretions and getting it down into the lungs where COVID-19 really does damage is going to increase. But there's another more ominous thing, I think, from a societal point of view, which is that every time that person breathes, every time that person sneezes, every time that person coughs, the amount of virus that's going to be carried in their respiratory droplets is now going to go up by about 70%, which means that the likelihood of somebody who is not socially distanced, who's not wearing a face mask, when they come in contact with that, right out of the gate, they're going to be getting a higher amount of that virus that they're going to come into contact with. From a epidemiologic and societal point of view, this is a game changer. This is going to take everything that we've been wrestling with and just put it on steroids. It's as if you've got a car that you've been running already, and suddenly you put a turbocharger on it.
Wow. Well, Dr. Shah, we really appreciate you coming on to add your analysis to this story. And as always, you put such a great emphasis on mask wearing as such an important precaution to manage this pandemic. We'll reiterate that again to our viewers.